So I'm going to be talking about early diagnosis and screening. And so for most of you in the audience that are nephrologists in the intensive care, this is really, if you step back to how those patients get to you, is what we're going to be talking about. So not so much inside the care, inside critical care, but in screening. So you all know this prevalence of CKD. 1 in 7 people in the U.S., or 37 million, have chronic kidney disease, and 9 out of 10 don't even know they have it. And it's usually defined. So how do we define that? How is screening done? It's defined by either serum creatinine and a measure, estimated GFR, or albuminuria. So why do we need to screen? I think it's clear that there's a high prevalence of CKD. There are simple interventions that can be taken to help patients, which would reduce morbidity, mortality, and improve their quality of life, and of course, potential cost savings. So where should screening happen? And this is something that I think is a big challenge in lots of our healthcare industry, is that the primary care physician or the family physician is the center of the primary point of contact for a patient, and trying to reach that primary care physician and have them have all these things at the top of their mind, the diabetes, the hypertension, those they're very familiar with. But I think CKD, because it's more silent in its presentation, but also in its, it's not very visible. I think it's not as top of mind for the family care physician. And then, or do we do screening in the community like is done for hypertension? And I think there's lots of good work being done in that area of being done at churches and community events, for example. Is that where we should be screening for CKD patients? And then to get those referrals on to the nephrologist. So why doesn't it happen right now? I mentioned this, that primary care physician, which is burdened with many different hats, has limited time, and it's a matter of trying to gain that mind share. So raising awareness, I think, is very important. And something I've been thinking about as I've been sitting in this audience listening to all the really excellent talks is that how do we raise that awareness? And I think that the kidney has an image or a visibility problem in that the person on the street knows about diabetes, knows about blood sugar. They think about that, but they don't think about their kidneys and how important it is. So I've been thinking about trying to think about ways or analogies that can help make it more sticky, help make the public more aware and keep it top of mind, and at the same time also keep family care physicians. So I was surprised at this stat that I looked up, which is that the number of people in the US with kidney disease is about equivalent to the number of people with diabetes. And again, like I said, I think diabetes is much more, people are much more aware of it. So what are the analogies that I've been thinking about? And I'm really open to having this as an open discussion, because I think as a community, I think it's important. So when you think about kidneys, you think about waste management or removal of toxins, or is it really recycling, like the recycling truck that, because we're reabsorbing things like amino acids for reuse, and we're reabsorbing electrolytes so that we can keep them balanced. So is it a waste management analogy that we try and bring out? That's not very sexy, I think, but that's one possibility. And when things go awry in waste management, so I grew up in Toronto, Canada, and they had a garbage strike back in the early 2000s, and so the garbage was piled up. So the waste is piled up in recreational facilities, tennis courts, hockey arenas, and such. So, but that doesn't show you the importance of the kidney, and that you could die, you would die if it's not functioning appropriately. So one analogy, and I know you've all thought about it. It's filtering the blood, it's waste management, it's electrolyte balance. So when you think about balance, I live in Buffalo, New York. Niagara Falls is right next to it, and Nick Wallenda a few years ago did a tightrope walk across the falls. So is it an analogy of the kidneys keep our electrolytes and things in balance, and if it tips over too far to one side, well, then you die. That's how severe it can be. So those are a few things that I've been thinking about, and I'd like to try and raise more awareness to that and have more public awareness so that we can have screening. And when we think about diabetes, the diabetes analogy, similar number of patients, we have point of care testing. Did that drive public awareness, or did public awareness drive the diabetes testing, the finger stick testing that we have? So, I think it's a bit of a circle. They have a feedback loop. And in the case of kidney disease, so I think we're at a similar situation. So diabetes has a silent progression. There's point of care finger stick testing that makes it easy for patients to check, or people in their homes to check their own blood sugar, and there's medication to treat it. And I think with kidney disease, we have the same thing. It's silent progression. We now have point of care finger stick testing, and just recently the SGLT2 inhibitors allows a medication to help these patients. And I think prior to that, those medications being cleared and approved and showing efficacy, we didn't really have all three of these features. So maybe it is the right time to start screening for kidney disease. How should we do that? I mentioned the finger stick creatinine is a possibility to measure estimated GFR, and then a dipstick urine for proteinuria. And then what was interesting at these presentations is learning of the stratification between function and injury, so the biomarkers that are used for injury of kidneys. That's probably not, I would imagine, not relevant in the case of the screen. The screen is something you want to do rapid and inexpensive, and those biomarkers could then be used after a patient is referred on to a nephrologist. So this is just the 0x25 study that many of you are aware of, where they used exactly that approach of a finger stick and a dipstick proteinuria. But this was before we had the SGLT2 inhibitors. And as a final note, the StatSensor creatinine meter really has many of those values that make it unique and convenient for screening. So it's simple, it's fast, it's only 1.2 microliters of blood, and it's comparable to lab testing. So the EGFR, the meter then calculates EGFR after you input age, gender, weight, etc. And so this is one possibility, and at Nova we're excited to be able to try and partner to screen patients and then have better outcomes at the end of the day for those patients. So the last thing, I'll just mention, I've been talking a lot about screening, but in the case of the intensive care settings where you are, it may be, and I've heard from some nephrologists that it's useful to have something that draws such a small amount of blood if they're going to be doing it many times in the ICU, for example. So it allows for immediate results and quick decisions so that you can move on.